from Will Use It.
Hello everyone, this is us from Will Use It. Today we are showcasing you about coronavirus. Coronavirus, the prevention and all the things you need to know about it. Coming to the virus. What is a virus? Virus is a non-living agent, but infective. That means it has no life, but it is a group of molecules of proteins, nucleic acids, lipids, and carbohydrates. They can't multiply or they cannot cause you any disease until they enter the living cells. That means they enter you. The coronavirus, it is a newly emerged virus, emerged from China and spread all over the world. The global disaster. The COVID-19, the official name given by World Health Organization, is a short form for Coronavirus Disease 2019. When you suspect yourself that you might have incorporated the infection from coronavirus, then you need to check these symptoms: low-grade fever, body aches, coughing, nasal congestion, runny nose, sore throat, shortness of breath, pneumonia in severe cases. The symptoms may not be seen in some cases. How does the coronavirus spread? Coronavirus spread from person to person, from animals that is not documented, from fomites, yes, possible. Like if you use the things the infected person used, you might acquire coronavirus. So how the transmission occurs? Coronavirus is an airborne infection, like airborne droplet infection. When an infected person coughs or sneezes, the droplets containing the virus may land in the mouth or noses of nearby people or possibly inhaled into the lungs. The fomites. A person can also get the coronavirus by touching a surface or object that has virus on it and then touching his own mouth, nose, or eyes. The fluid. Possible, but not known. Other body fluids. Unknown. The prevention. How do you prevent the coronavirus? Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth repeatedly. Stay at home if you are sick. Don't go out unnecessarily. Cover your cough or sneeze with a tissue, then throw the tissue in a closed trash. Have cooked food. The virus would likely be killed by cooking. Avoid uncooked raw foods, sandwiches, chutneys, and salads. Clean and disinfect frequently touched objects using regular household disinfectants. These include the tabletops, the doorknobs, the toilets, the phones, keyboards, tablets, bedside tables, pens, towels, etc. Wash your hands with soap and water for at least 20 seconds. The alcohols and the bleaches can disinfect bacteria, fungus, including certain viruses. Take precautionary and make ideal use of them on different surfaces if only necessary. Use alcohol-based hand sanitizer with at least 60% alcohol, covering all surface of hand. Wash your hands after going to bathroom, before eating, and after blowing your nose, coughing, and sneezing. Wear good hygiene clothes. Wash your clothes with adding drops of disinfectant liquids. Iron them or steam them. Good protective masks like N95 can be helpful by avoiding direct contact of droplets from infected as well as risk person. Masks should be disposed in a closed trash. Don't overuse the mask. Change it regularly. Don't try to wash it. Don't reuse it. Don't throw them in public places. Mask doesn't provide 100% protection. Don't move out unnecessarily. When you go out, use good mask, but as soon as possible, clean all the parts using soap, especially hands, face, and all the exposed areas. Also, can add drops of disinfectant liquids in the water. Wash your hand with soap before and after bath. Avoid touching nose, eyes, mouth before bathing. Don't shake hand with others. If it happens, avoid touching your face. Don't travel. Don't use public transports. Don't be in markets, functions, bus stands, pubs, nightclubs, restaurants, malls, or any gathering or crowds. Obtain several weeks of medications, groceries, clothing, and other daily requirements and supplies and stay at home for prolonged periods. Keep space between you and others, especially the sick ones. Avoid cruise travels and unnecessary air travels. Don't smoke. Don't intake much of alcohol. Eat a diet high in fruits, vegetables, and grains that is necessary for your immunity. Coronavirus can infect easily the low immune person. Stay up to date with news update. Keep all your requirements with you. The stores outside may shut down, like medications, glucose and blood pressure monitoring equipment, fever and pain medicines, cough and cold medicines, fluids and electrolytes, soaps and sanitizers, tissues, toilet papers, diapers, and sanitary napkins. If you think you or your child may have COVID-19 infection, first call your doctor. They direct you to the best place for evaluation and treatment. Use gloves while handling soiled items or washing or even when necessary, and dispose them in closed trash. So what are the things you need to know about coronaviruses? Too warm or too cold weather cannot stop outbreak of COVID-19. The packages from China may or may not harbor coronavirus. Packages can act like formats, but it is said that COVID-19 can survive up to 3 days on plastic and stainless steel, up to 24 hours on a cardboard, and up to 4 hours on copper surfaces. And moreover, the virus outbreak started in China, but now is global. If packages harbor coronavirus, then the package handlers, delivery boys, and customers are at risk. It's not clear if it can be spread by an infected person through food they handled or prepared. But virus also been detected in stools of certain people, so it cannot rule out the possibility of infection through food by an infected person who has not thoroughly washed their hands. High-risk community. Who are at higher risk? The older people, especially above 60-year-old, whose immunity is not strong enough to fight the coronavirus. The patients of chronic bronchitis, emphysema, diabetes, other respiratory disorders, and immunocompromised states, and even the children. So what are the challenges to develop antiviral corona drug? The antiviral drugs have to target specific part of virus's life cycle that is necessary to replicate. Antiviral drug must be able to kill a virus without killing a human cell. The viruses are highly adaptive, hence can rapidly replicate or mutate. So everyone, this is everything you need to know about coronavirus. Never panic. Consult a doctor if you feel you are under infection. And keep yourself safe. Follow all the precautionary things. Thank you. Have a good day.